Ready?
So, good afternoon, everyone. I am Dr. Sagar Bhuyar, intervention cardiologist working in Kamineni Hospital, Nagar. So, the idea of today's very short message and talk, we are hearing news now about the recent surge in the COVID infection in China, Korea, and Japan. And we got even letter from the WHO regarding the fourth wave alert. And already in USA, there is a surge in the cases. And today I'm going to talk about coronary artery disease and try to create the awareness among the youth. They can understand the magnitude of this problem, coronary artery disease in young people, and the impact of COVID on coronary artery disease. And the main and important thing is how to prevent coronary artery disease in a youth, and also somebody support from COVID. Now you can go back to the history. If you see in last few decades, from 70, 80, then 90, 2000, now 2010 and 2020, you can see there is a significant increase in the heart attack, particularly in the Asian country and particularly in India. As compared, if you see all the Asian countries, I think there is a significant increase in the heart attack cases in India. Now, what is coronary artery disease? Coronary artery disease is the disease of the blood vessel which supplies the heart. Disease means it's a narrowing of the coronary arteries because of inflammation and deposition of the cholesterol. Now, you see now in the recent few decades that coronary artery disease, which was disease of the old people, now it has become the disease of the young people. Now, many young people we used to see in the fourth decade. Now, since last 5 to 10 years, we are seeing even in 30s and even 20s also patients are suffering from massive heart attacks. And you can see now that as far as treatment of the heart attack is concerned, there is a lot of improvement. There are a lot of new drugs and technique like angiogram, angioplasty, then availability of the hospital even at the district level. But if you see the data, the patient dying every year from the coronary artery disease is increasing, and increasing. So it is definitely a frustrating for the medical fraternity and even for the society, because now there is advancement in the treatment. And why the number of deaths due to heart attacks are increasing. Now, heart attack is the number one cause of death if you see all the diseases. So, heart attack is a very important condition, and it's a very alarming data that the numbers are increasing and it is affecting the young population. Now, everybody knows now what are the causes of coronary artery disease or heart attack. It's simple. Your genetically, that means your family history. If somebody is having coronary artery disease at a young age, you are having more risk of getting heart attack. Then if you are obese, your body mass index is on the higher side, you are having higher risk of heart attack. Then all of us know that hypertension, diabetes and cholesterol, these are very important risk factors for the heart attack. And smoking. Now if you see in the last 10 to 20 years, because of the rapid change in the lifestyle, that people have become more sedentary, and now a lot of mechanization, and we are using more car, two-wheelers, and the mechanical work has significantly come down. And because of that sedentary lifestyle, the BMI has increased, the obesity, childhood obesity. In the second and third decade, we are getting nowadays obesity because we are not doing any active work. We are become sedentary, just we are doing our mental work, we are getting tired, and our weight gain is a main issue. And because of that, there is a significant increase in the hypertension. You can see the prevalence of the hypertension. Now the WHO is telling every fourth Indian is hypertensive. That data is alarming. That means almost 25% of the 30% of the population, the blood pressure is a major issue, and blood pressure is a very important cause of coronary artery disease. Then diabetes incidence is going up because of weight gain, obesity, there is the insulin resistance, and sedentary lifestyle is a major and so much of Chinese, so much of food with preservatives. And because of that, what happening is because of this bad dietary habit, there is a significant increase and derangement in our lipid level. So you see now increase in the obesity leading to diabetes, hypertension, high cholesterol level. And another important thing is the stress, which is a major trigger factor. So stress now it is because of so many things, because of urbanization, lot of population, traffic, our working hours, then there is a corporate culture has come, a competitive environment right from the childhood. We are putting pressure on the kids for their based on their performance and a lot of comparison. So the modern life is full of stress. That is one of the trigger factor. So underlying already you are having hypertension, diabetes, and other comorbidities, and add on if there is a stress, mental stress, that will add on to your heart attack. So definitely the WHO has warned India that you have to launch an educative program to educate your youth healthy diet so that they will not get hypertension, diabetes, high cholesterol, and finally the heart attack. So so many people, they are dying suddenly after the COVID infection. That means the doctors are not expecting the mortality in that particular case, and the people are dying next day. So first few weeks they are not able to understand what is going on, because everyone was thought it's an influenza virus. COVID is an influenza virus that is affecting the lung. And why? Because the lung involvement is less. Why patients are dying? So then slowly they have done some autopsies and they found that in COVID there is an increase in the blood clotting, particularly in the lung, in the coronary artery. There is involvement of the heart also. And then a lot of data and the research has come on that. And this is the first time we have seen that some virus is causing coronary artery disease, heart attack, damage to the heart, and clot in the pulmonary artery, which is causing the deaths. And we are seeing there is an increase in the heart attack after the first wave, increase in the heart attack after the second wave, and even we have seen there is a rapid surge, 6 times increase in the heart attack after the Omicron third wave. Even though that Omicron was mild variant, but there was significant increase in the heart attack in the post-COVID. So I think in COVID infection, there are two things which are very, very important. First thing is, in COVID, there is a generalized inflammation in the body. So COVID virus will cause inflammation. Inflammation will also goes into the blood vessels of the heart, that is called as coronary arteries. And whenever there is an inflammation, there is a high risk that the clot may develop inside the blood vessel, leading to heart attack. And also the inflammation may go into the direct heart muscle, that is called as myocarditis, leading to heart pumping will come down and leading to sudden death. Second important thing the COVID will cause is increased blood clotting capacity, leading to clots inside the legs or sometimes directly into the lungs, putting the pressure on the heart, blocking the circulation, and leading to sudden death. That is called as pulmonary embolism or deep venous thrombosis. And we used to see that many a time, I think many people, even laymen also knows that we are doing CRPs and D-dimer in the COVID infection to know whether there is any underlying inflammation or any increase in the blood clots, because if the blood clots are there in the body, the D-dimer level will go up. So even though there is a mild COVID infection, mild means it has not affected the lung much and not having significant symptom, any breathing difficulty or any decrease in the blood pressure or very high grade fever. In those patients also, sometimes there is a underlying inflammation leading to very high CRP level, vascular inflammation, and it may lead to clotting in the blood vessels and heart attacks. And even if the D-dimers are very high, then definitely it's a marker that your body is already having clots somewhere and you are at the high risk of getting some complication. Now, how to prevent the coronary artery disease in a COVID patient, or because now there's a surge, the fourth wave may come to India. So definitely it is very important that not only we have to prevent the mortality from the COVID, but we have to prevent mortality from the heart attack, which are very, very common secondary complications of the COVID. Now, first thing is you have to screen yourself where how much you are having risk of getting heart attack. That means you are having any hypertension, you are having any diabetes, you are having any high lipid level. Is there any history of previous heart attack? So ECG, echo, or any treadmill. Is there is any disease in your coronary artery, and you have to calculate the risk score. We have now the apps to calculate the risk scores. And if you are fitting in a high risk, then definitely if you got infected with the COVID, then you are the candidate where the risk of heart attack will be almost 3 to 4 times higher than and those people who are they are not having any hypertension, diabetes, high cholesterol. So if your risk score is high, more than 7.5% or 10%, definitely you are the candidate where the risk of heart attack is more after the COVID infection. Second thing is, try to get prevent your infection. That means follow the rule. Okay, avoid going to the crowded places, wear the mask, and social distancing. It's very important because prevention is always better than cure. Suppose if you got infected, because it's a very infective virus, in spite of taking precaution, you may get infected. So don't be panicked first. Get yourself tested, consult a pulmonologist, physician, or a cardiologist. Assess your first the risk of heart attack, any hypertension, diabetes, cholesterol. Get yourself checked, get one ECG and echo done. Get your marker. CRP is a very important marker of underlying inflammation. If the CRP is very, very high, definitely you are at definitely high risk. Another marker which is very important that will tell you about the underlying clot is D-dimer. Get your D-dimer done and consult regularly with your physician or pulmonologist or a cardiologist, and we can prescribe certain medication sometime because you are at a very high risk. Then you can give some blood thinners like aspirin, and if the D-dimer is very high and if there is evidence of clot already, then we'll give some oral anticoagulant for a few weeks so that we can prevent a heart attack. So don't be with a panic and don't neglect. Consult your physician or a cardiologist. Identify whether you are a high risk candidate or you are not a high risk candidate, and then again repeat CRP and D-dimer levels after 4 or 5 days or a week. Suppose they are declining or they are on the increasing trend, and proper selection of the medication, because see, those medications are not that safe because there are blood thinner. So left and right prescription is also not feasible. It is not recommended by guidelines. We'll give those medication only for whom those who are having very high risk of getting heart attack, and COVID will increase the heart attack almost by 3-fold. Or already there is evidence of inflammation, or any D-dimer or ECG echo shows some evidence of already having some cardiac issue in a COVID patient. Another important thing is the steroid. The steroid is what criticized the first and second wave. We have seen so many people, they got admitted with lung involvement, and we forced to give steroid. And after that, what happened is the rampant use of steroid led to mucormycosis and other complications. So I think definitely left and right use of steroid is not at all recommended in COVID. There are some specific indication only. So try to avoid steroid unless and until some specialist, particularly those who have experience in treating COVID, don't take steroid unless and until some physician or cardiologist recommend you to take steroid to decrease the risk of getting your lung involvement. So I think steroid is very, very dangerous because if you give in the early phase, first 7 days of infection, the replication of the virus will be more, leading to inflammation, more inflammation, and again making you prone for cardiac complication like myocarditis or sometime heart attack, inflammation in the coronary artery disease. Okay. So definitely the COVID has big impact on coronary artery disease, but we have prevention remedies. So don't be panic always. Okay. So get yourself checked is very, very important. Okay. And proper medication in a proper patient is very, very important. And avoidance of unnecessarily steroid is very, very important. Then sometime in COVID we have secondary infection. So proper use of antibiotic in a COVID patient also is an important thing. So in today's talk, major thing I have highlighted is there is a significant increase and surge in the heart attack in the youth. So that is a very important thing. I think every youth, Indian youth, should understand that and try to help in prevention by improving his lifestyle, his diet, and early screening for diabetes, hypertension, and dyslipidemia. COVID has definitely has very bad impact on the coronary artery disease, but I think prevention of a COVID, I think if you use the COVID guidelines and try to prevent getting you infected, that is the first thing. And if at all, if you get infected, I think proper evaluation and proper starting of the medication on time is very, very important. Because if you delay for 7 days, 8 days, already D-dimers are high, CRPs are high, already there is inflammation in the blood vessels, and already there are clots, then we may not be able to help you. So definitely, the moment you get infected, any symptoms suggestive of COVID during the wave, get yourself checked with proper investigation, and identify who is at risk and who is not at risk, and what are the medication we have to give. That is very, very important. So I think in the last, I want to tell you the advance Happy New Year, and don't be panicked, because now it's just a WHO notice for us. There is no significant surge, but I think taking precaution, try to avoid going to the crowded places and use masks and social distancing so that the spread of the COVID we can reduce. And during COVID, if at all, if the fourth waves come, I think we have to be careful, not only from the COVID infection, but also from the heart attack, which are the very important secondary complications from the COVID. So thank you very much, and Happy New Year in advance. Thank you.